Hi, my name is Devika Dixit, and I'm a consultant with DMOSH, working with Dr. Esther Tan, and I will be conducting a brief training on how to use the CDC's Ebola PPE Calculator. For the outline of this presentation, I'm going to start off with the importance of standard precautions. Next, I'm going to discuss the factors that we need to use to determine the amount of PPE that's needed for a Ebola virus disease case. Last, we're going to review the CDC's EVD PPE calculator and how to use that. So quickly on standard precautions, because I think it's important to review these often, and a reminder that this is for all patients at all times. So the cornerstone of standard precautions really is hand hygiene, and you can see a picture here of the WHO My 5 Moments for Hand Hygiene. Next is you want to select personal protective equipment based on the point of care risk assessment that is done based on the situation, as well as based on which pathogen you are suspecting or that might be confirmed in a case. Next, we need to be careful to prevent needle sticks so that we are not exposing ourselves to bloodborne viruses such as HIV, hepatitis B, or hepatitis C through those needle sticks. So sharps prevention is really important. Respiratory hygiene and cough etiquette is another part of standard precautions, and that's really been highlighted with the COVID-19 pandemic. We want to make sure we're doing environmental cleaning, and this is important because sometimes we need different PPE or different grades of PPE to be able to do this kind of heavy duty cleaning. Next is about the linens, in that we need to make sure they're clean, they're handled properly, as well as transported appropriately. Next is waste disposal, that also needs to be done safely, as well as the care of patient equipment. So if we have equipment that's reusable, such as a stethoscope, we want to make sure that we're cleaning it between patients, or else have a dedicated stethoscope for each patient, for example. So there are several factors that we need to consider when we're trying to decide how much PPE is needed for Ebola virus case in any specific setting. So be that your clinic or your hospital. So these are some of the main factors. There are others, but these are some of the ones that I've highlighted. And these include the type of facility. So is this a facility such as a level 1 clinic, or is it a clinic that has the capacity for more advanced care or patient beds, for example? So that is important to consider when we're thinking about how much PPE is required. We also want to know how sick we think the patient might be that's coming in with suspected EVD. Healthcare worker roles within the clinic and facility are critically important, and you're going to see when I show you the calculator how this is going to affect things. Length of shifts, including breaks, such as breaks to have lunch, for example, or breaks because of heat. We want to make sure that we're using that when we consider how much PPE is required, because each time you take a break, you're going to have to change that PPE. The waste management strategy is also important because, as I mentioned, you may be using different amounts of PPE or types of PPE depending on what kind of job role you're doing. And I think it's important to highlight here that you're going to be dealing with suspect EVD cases for the most part. And as we know, Ebola and other infectious diseases such as COVID and others might present with things like just fever. And so you really have to be careful that you're considering your broad differential diagnosis, which is why the standard precautions are so important. You have to treat every patient as if they could have an infection, and then you need to decide what that infection may be. So the last piece really, which is the focus of this, is the CDC Ebola virus disease PPE calculator. And I'm going to show you how to use that calculator, which is available at this website. So because it is CDC, it is based on obviously American settings. However, I do believe that this can be applied to other settings as well. However, your assumptions and some of the numbers of healthcare workers, for example, in a facility may change, but really what we're focusing on is the PPE. So I'm going to try to switch my screen now, so just bear with me for a moment. All right, you should be able to see my screen now. This is the website that I was talking about, the CDC website and the calculator. And as you know, as I talked about, this is going to be an estimation. So it's not going to be precise to the exact number of PPE, but it's going to give you a good sense of what you need. So when you go to this website, you will see a lot of these things that I talked about before, such as the acuity of the patient, the roles and interactions with the patients, and lengths of shifts. But as I said, I've highlighted some of those things on the previous slide. Then you're going to see some examples of healthcare team roles and descriptions, all of which may not be relevant for your setting. So for example, nursing staff is likely going to be present in your clinic setting, as well as hopefully a physician. But in other circumstances, you may not have individuals such as trained observers to assist with donning and doffing of PPE. If it is possible to have an individual such as this, that would be a good thing. However, it's not always possible given the amount of personnel. So these roles can be reviewed, but they may not be directly relevant to your setting. This website has further examples of how many, how much your total personnel might be. And so it's just something to look at afterwards. But the focus, once you go to this website, so the CDC website with the PPE calculator for Ebola, you're going to click on this tab here, and it is going to bring up the PPE calculator. I'm going to go to that PPE calculator now because it's an Excel sheet. So I'm going to try to switch my screen again. So let's just see how that goes. Okay, so there are two tabs we're going to focus on here, the tool overview as well as the PPE summary. And just to note, what is most important on the overview tab is that these calculations are mainly for one patient that's hospitalized. So you may not have a patient that has the ability to be hospitalized in your facility. For example, you may be in a clinic that doesn't have the capacity to have a patient stay overnight, but you can still use this as an estimate for how much PPE you need to use. I will show you where you can change this assumption in the calculator as well, but in general, you want to plan for at least one suspect patient. So this tool is going to guide you in Ebola preparedness when you're thinking about your PPE needs. It's meant for a multidisciplinary team because Ebola care, so care of a patient who has EVD, really should not be done by one individual alone. It needs a team effort. And these assumptions are based on the University of Nebraska Medical Center, Emory, as well as CDC, as well as other subject matter experts. However, this can still apply to any setting, including the mission settings. You just have to change your assumptions. So then we'll go to the next tab there, and I'm going to talk through some examples. Basically, the only thing you need to change, or that will be needed to be changed to get your calculations, are the items that are in the yellow boxes. So first, we're going to look at the different healthcare worker roles. So you've got nurse, physicians, a trained observer, environmental services, as well as a lab technician. And you may not have all of these individuals working in your clinic or hospital. And therefore, if that's the case, you can just put 0. So if you have no trained observer, you can stick the number 0 in here, and then you're going to not have a problem, and it will automatically calculate your PPE. We're just going to use the nurses as an example here. So you're going to select the number of people per shift. For example, you may have one nurse that works in your clinic for 12 hours, and there are 2 12-hour shifts. And let's assume that that's a different person. Therefore, you've got 1 person per shift, 2 shifts per day, and that's a total of 2 people. And of course, every time you change this number, so let's say we had 10 nurses, all the rest of your calculations are going to change. So let's stick with something realistic. So we will have 1 nurse that changes 2 times per shift. We will have 1 physician, and that's the only physician there. So they are on for 1 shift, which is 24 hours. You have no trained observers. You can put a 0 here, but either way, your calculation, because it's 0 times 2, is going to be 0, but we can change it anyway. Let's say you have 1 environmental service worker for the full 24 hours, so that's a 1. And then you have 1 lab technician for 24 hours, so that's a 1. So now you've got a total of your team of 5 healthcare workers for 1 day. As I mentioned, if you wanted to change this, so let's say you were keeping a patient there for 30 days, you could change that number and all of these calculations will change. However, as mentioned, most of the facilities are going to only have the capacity to really keep somebody for 1 day. And so most of the calculations default to that. But as I said, if you need to change it, you can. So if we stick with the nurse, for example, we can move further down here and we can see that we've got, since we have 1 nurse that changes twice per day, that means there's a total of 2, right? So this number and this number is the same. And then you have, as you go across, what type of PPE you're going to need. And all of this PPE is listed, but it's in different categories. So you've either got the gowns or the coverall and you pick which one, or the other category where you have one or the other is the PAPR or the N95 for the aerosol generating medical procedures. And then you've got the rest of your PPE here where you've got your gloves, the 2 different types of gloves, your boots and shoe cover, and plastic apron. The one thing that isn't on here is, of course, the medical mask, and you should also have supplies of that already on hand, particularly given the COVID pandemic right now. This is a critical part of the standard precautions. But as you will see, there will be an automatic calculation for your PPE that you need, and you will have your totals here, and that will help you for procurement. This third tab here just has a little bit more information on assumptions, but isn't critical to the utilization of this spreadsheet. So hopefully that helps. And if you have any questions on using this tool, please contact Dimash, but otherwise have a look at it and play around with the numbers because it's actually quite simple to use. Thanks for your attention.